Now inside these tendon sheaths, inside this, this cable area, there's a little bit of liquid called synovial fluid, and that's like a lubricant. So as your fingers move back and forth, back and forth, back and forth, back and forth, there's natural lubrication in there. If you're at a computer or a musical instrument for hours at a time, guess what? That lubricant's going to get overheated and dry up. It's, it's not well refined like, modern motor oil. It was made for cavemen, and we haven't evolved that far since then. We're not made to do this without brakes. So this gets all dried up. And when you're having your wrist so it's not at a neutral angle, this is a neutral angle, so it's a straight line here. Anytime you're flexing or extending your hand at a non-neutral angle, these cables have to go around a corner. If you're deviating your hand to touch different areas of a keyboard or a musical instrument or whatever you're doing, anytime you're doing that, this cable has to flex around a corner. If it's already irritated because that lubricant has dried up, guess what? It's going to be really irritated. It's going to start swelling up. And if it's swelling up, it puts pressure on the median nerve, which causes it to be pinched, and there you feel numbness or pain. Now, there's things that we can do for that. Don't rush out and get surgery. No, no, no. The only time you should even consider surgery is if you're at risk for losing your nerve function in your hand altogether. Other than that, you've got time. This builds up over a long period of time. You can get rid of it. You can get your hands back to normal again. It takes effort. But most of the time, you have the pinching in the nerves. It's not coming from the carpal tunnel area at all. Or if it is, you've got other problems too. And if you can relieve the other problems as well as the carpal tunnel, guess what? Your hands will feel normal again. Woo, wouldn't that be great? More often than the carpal tunnel, it's the forearm muscles that have been overused because you're gripping too much, you're overusing your muscles. These muscles get hard and tight and start to pinch on your nerve. And they also pinch on a muscle called the pronator teres. And what that muscle does, it is a forearm muscle. It's a short one. It doesn't move your fingers, but what it does do is it turns your hand over. So if you grip your hand about an inch or two below the crease of your elbow and then turn your hand over, you'll feel a muscle. Just feel it in there rolling. Well, that sucker gets tight, really tight, and it will pinch on the nerve. The other muscles tighten around it too. So what we're going to do in our first video is loosen up these muscles, work on the carpal tunnel ligament, work on your hand muscles, and we're going to do it without using your fingers of your other hand because guess what? These fingers of your other hand probably aren't that happy either, okay?